course, the virus continues to spread across the continent as more cases are reported. Let's get you more now on the continent's preparedness. I'm joined here in our Nairobi studio by Dr. Moses Masika, a virologist with the University of Nairobi. Doctor, thank you so much for your time this evening. We were just speaking, of course, to our reporter in Addis Ababa. And as far as preparedness is concerned, she's talking about call centers, isolation wards, and even ministerial committees to address the coronavirus outbreak. It has been slow to come to Africa, but now we're looking at about 178 cases in 18 countries. Do you think Africa is prepared?
Thank you. I think Africa is partially prepared. I say that because we've seen many countries so far being able to handle dozens of cases, a few cases, not some dozens. And that shows that even though we've not been able to stop the virus from spreading, there has been some effort to control its effects. But I think even though there have been steps to prepare these countries, it could be, the system could be overwhelmed if we get too many cases too soon. And that is the same case with any system. That if we get hundreds or thousands of cases in quick succession, any of these systems are quite fragile and they could break. But I think many governments have taken good steps that we welcome to control the spread.
I mean, there are concerns that African health systems are particularly fragile, particularly vulnerable to being overwhelmed. What's your view of, I mean, we can put in these measures now, but it doesn't erase the fact that a lot of work in creating strong public health systems hasn't been done for decades.
That is true, that many countries in Africa do not have these systems in place, and the smallest crisis such as this would pull them to the limits and possibly crack them. I think it's an opportunity for us to see these systems improve. We've seen it before with Ebola, that some of the countries that were struck by Ebola got an opportunity to improve their systems. Many of the countries in Africa haven't had a similar challenge. But I think from what we've seen across many countries, there has been an effort to use what they have to address the current problem. I think it should also be a call for all of us to focus on what we can do so that in the future, if something happens, we are more confident in the systems that they will serve to help in the situation rather than being a challenge.
We shouldn't actually have to wait for a crisis either, isn't it, to beef up our systems. But of course, as more information is coming out about the coronavirus, it's also being, on the other end, countered a little bit by misinformation and fake news and people making suggestions about how the disease is transmitted or what kind of protective measures to be used. I've read one recently saying that vodka helps. In your view, though, what is the most important information that needs to go out to the public in order to prevent the further spread of corona?
Not vodka, for starters. But I've liked the comment by the Ethiopian Minister for Health that this is not the time to panic, but rather the time to do what we can to curb the spread of this virus. There are things that each one of us can do, such as washing our hands frequently with soap and water, hand sanitizers, social distancing for those who are sick, but also for those who are not sick, to stay away from crowds or people who are maybe sick, to clean surfaces frequently with soap and water. These have been shown to work. And if somebody does show symptoms, to isolate at the appropriate place. For some countries, this may be a hospital. For others, with many cases, it may be at home, depending on what their governments have advised. And I think with the right information, people should be able to avoid panic, although it's easier said than done, and to take the steps that they need to prevent themselves from getting infected.
So maybe just perhaps go into a bit more further detail on that. When should one panic? Is it when my temperature reaches a certain amount? And what exactly should I do? What are the key steps to take if I'm worried about my health?
Not at all, actually. You shouldn't panic at all, because even if you get sick, you can be helped, and only very few of the cases have passed on or died because of the coronavirus. So I would say, first of all, being exposed. You may be aware or may not be aware, depending on where the stage of the outbreak. In Kenya, people who have traveled are likely to be at risk to certain hotspots. But if the outbreak is spread out across the country, it's difficult to know when you are really exposed because you're dealing with so many people at the same time. But if you suspect that you are exposed, you should be vigilant, meaning that you should monitor your temperature several times a day, check if you have any symptoms like cough and feeling of tiredness. And if you really get severely sick, some people may begin to have difficulties in breathing. At that point, you should be heading to hospital. You may, if you suspect you're exposed and begin to show these symptoms, it's good to go to the hospital so that they can confirm and isolate you and also advise your contacts on what they can do. But if you're going to panic, then it's not going to help you because then you make the wrong decisions. So I would say monitor your symptoms. If you get fever, get tiredness, get a cough, then go to the hospital for a confirmation test, because it could be something else. And if they confirm, then follow the instructions that they would give you so that you protect others and yourself.
Indeed, and that is very important, protecting others too. Yes. Well, thank you so much, Dr. Moses Masika, joining us here in our Nairobi studio. He is a virologist with the University of Nairobi.